Today we're talking about stroke, a medical emergency that happens suddenly and can change a life in seconds. Stroke is one of the leading causes of long-term disability in the U.S., but recognizing the signs early and getting fast treatment can save lives and brain function. We've got Dr. Kasim Quershi here to explain what stroke is, what to look like, and how it's different between men and women, because there are significant differences. Thank you so much for being here.
Thank you for having me. Yeah, there are significant differences between men and women in terms of what they can experience with a stroke. Both men and women can experience some of the same signs.
Okay.
Face drooping, an arm or a leg going weak, a speech problem, or a vision problem. However, women can experience some unique symptoms. Sometimes they come in with their strokes and they're having headaches or confusion or nausea and vomiting. And sometimes those symptoms don't get recognized because they're not quite as typical for stroke as what we're used to hearing.
Yeah, absolutely. Okay, and let's talk about what a stroke is.
Yeah, absolutely. A stroke is a medical emergency. It happens when the blood supply to the brain gets cut off. And the brain is a very special organ. It's very sensitive to having blood supply get cut off. It really needs oxygen. So every minute that blood supply gets cut off to the brain, it loses about 1 million brain cells. And as that continues to go on, that area of damage is what we call a stroke.
Okay, and so that's why getting to the doctor as quickly as possible is the most important factor here. So let's talk about the fast and what people need to think about.
Absolutely. We have a term called the golden hour of stroke, which is really that first hour after someone's experiencing stroke symptoms. That's when they should get into the emergency room as fast as they can. The longer you go with stroke symptoms, the harder it is for us to treat it. So once you're outside of the first hour, the effectiveness of our treatments gets a lot worse. Mm-hmm. We have a mnemonic to kind of help us remember what stroke symptoms are.
Sure.
Called B FAST. Mm-hmm. The B stands for balance. So if you're having sudden difficulties with balance or coordinating your arms or legs, that's a sign of a stroke. The E stands for eyes, so sudden vision loss, that can be in both eyes or one eye, that's a potential sign of a stroke. The F stands for face, so if you have drooping of your face, smiling and it's asymmetric, that is a potential sign of a stroke as well. The A stands for arm, and that refers to arm weakness, can also be leg weakness, it can also be numbness. The S stands for speech, and the T stands for time. Like we said, the faster, the better it is.
Yeah, so get to the doctor as fast as you can if you have any of these symptoms. Doctor, thank you so much for being here. TrinityHealthMichigan.org/stroke for more information.